Okay, this is the Gold Star Medical Company Compliance Training for 2017. It is April 20th of 2017, and all of the Gold Star Medical billing representatives, insurance verification specialists, and billing specialists have been invited to this company compliance training. All have indicated that they will be attending the compliance training. If for some reason they cannot attend the live training, I am recording this so they can listen to the compliance training at a different time. This compliance training is part of our annual compliance program through Gold Star Medical as far as a billing company goes, and we are going to go ahead and get started. So without further ado, let's see if I can get this. I'm going to close up my meeting thing. And all right, so basically when we're talking about a compliance program, the compliance program guidance for clinics and for billing companies is published in the Federal Register. And the Federal Register is the place where all federal laws and statutes are published. So the Federal Register may have laws that are in consideration. They may have laws that have been already published, and those are called the final rule. And there are also statutes and guidelines contained in the Federal Register that are not necessarily law but are listed as guidelines for behavior and compliance within the law and within the legal system. In 1998, the Federal Register published a guidance statute for third-party billing company compliance programs. And up until 2010, these compliance programs were voluntary. When Obamacare was passed in 2010, part of the law of Obamacare made compliance programs mandatory versus voluntary. Now, with that said, at this point, the Secretary of the Department of Health and Human Services has not established an enforcement timeline or date for this mandate. However, that does not absolve us of responsibility to comply with the law. And so what I'm going to be doing with you today, this is actually our first compliance training that we've ever done. It's long overdue. This is something I probably should have been doing years ago, but it's, you know, better late than never, and it's important for me to beef up our compliance efforts as a medical billing company. So what we're going to be talking about today is we're going to be talking about what the Federal Register says with reference to third-party medical billing companies, and what we need to do to comply with the compliance guidelines of third-party medical billing companies. These are excerpts. The actual document in the Federal Register is 3 or 4 pages long, so I'm not going to go through the whole thing. However, on the bottom of your screen, you will see that the Federal Register, Volume 63, number 243, and the published date. If you ever want to just go ahead and read the entire document on compliance programs for third-party medical billing companies, I would highly recommend it. Let me just see if anybody else has come on the call. We have several other people on the call now. Just so you know, you are on mute, and and if you have a question about anything that I'm talking about, please type it into the chat box so I can so I can answer those questions. So basically, let me go back up. It says with reference to third-party medical billing companies that third-party medical billing companies provide crucial services that could greatly impact the solvency and stability of the Medicare Trust Fund. Healthcare providers are relying on these billing companies to a greater degree in assisting them with processing claims in accordance with applicable statutes and regulations. And healthcare professionals are consulting with billing companies to provide timely and accurate advice with regard to reimbursement matters as well as overall business decision making. As a result, the OIG And for those of you who don't know this, OIG stands for the Office of the Inspector General. The Office of the Inspector General is the overseer of the Department of Health and Human Services. It provides the legal and watchdog oversight of the Medicare and Medicaid programs. The OIG considers compliance program guidance to third-party medical billing companies particularly important in efforts to combat healthcare fraud and abuse. Okay? And really what I want to try to get across here to us as a third-party medical billing company is that if any of our providers were to fraudulently bill claims to Medicare, and we were to know about that fraudulent billing and have not made our due diligent effort to prevent that from happening, we become as liable criminally and civilly as the third-party medical billing as the provider for any penalties incurred under that fraudulent billing. And so this is something that we have to really wrap our heads around and understand. And it's not just Gold Star that as a corporation that becomes liable, but all the people that work under Gold Star. So you as a biller would be liable. Okay, so we have to make sure that we understand what our responsibility is as a third-party medical billing company towards compliance through the OIG. Hi, Trang. I see that you're here. Great. Okay, standards of conduct. So what the Federal Register says is that billing companies should develop standards of conduct for all affected employees that include a clearly delineated commitment to compliance by the billing company's senior management, that's me, and its divisions, that's you. The standard should function in the same fashion as a constitution, as a foundational document that details the fundamental principles, values, and framework for actions within an organization. The standard should articulate the billing company's commitment to comply with all federal and state standards, and with an emphasis on preventing fraud and abuse. And again, I'm not going to read all of this, but these are excerpts. I definitely would recommend that you read the entire document contained in the Federal Register on billing company compliance, so that you will know if if you or your client are not falling under the billing company compliance guidelines. So what are the core elements of an effective compliance program? Now, Trang is on the call with me. Trang is on the call with us, and of course she's one of our billers, but she has also been through the Medical Compliance Specialist certification class with Dr. Mario, and this is one of as a medical compliance specialist, whether you're getting your compliance training through Dr. Mario or you're going through the Healthcare Compliance Association and getting your CHC, which is Certified Healthcare Compliance Specialist. The 7 core elements of an effective program are something that you're taught to memorize. I mean, we need, as compliance specialists, we know these 7 elements like the back of our hand. We can usually say them in our sleep. So the first element of a written compliance program is to have written policies and procedures for standards of conduct. The second is to have a compliance program oversight. That basically, in a nutshell, means assigning somebody in the organization to be the compliance officer or the compliance official for the company, to offer and conduct ongoing training and education in compliance, to keep open lines of communication between you as the biller, your client, and me as the compliance oversight director on detecting compliance violations within the company, to have continual auditing and monitoring to show that we are attempting to fall in line with an effective compliance program, to have consistent discipline if compliance is not being met, and to take corrective action. So those are the 7 core elements of an effective compliance program. This is the This is it in writing. And by the way, these elements of an effective compliance program are the same for any corporate entity. This is a corporation like Apple or IBM or Town & Country in San Angelo. If you have a corporation, you should have a corporate compliance program. So this isn't just for healthcare. This is for all corporate entities. And these 7 fundamental core elements apply to any corporation, not just healthcare. Okay? So basically any corporation that you work for should have the 7 elements of a compliance program outlined in a written compliance manual. I'm just going to give you a couple of examples of not to scare anybody, okay, but so for example, if you were to go to the OIG website, which is, again, if you've come on this call late, that stands for the Office of the Inspector General. The OIG is the watchdog that looks at fraud in healthcare, that investigates fraud in healthcare, and that prosecutes, not prosecutes, but handles the civil side of healthcare fraud and abuse. If healthcare fraud is so widespread and so heinous that it falls under criminal penalty, then it moves out of the Office of the Inspector General and is referred to the Department of Justice, and that's where the FBI gets involved. Now, these are through the OIG, and these are civil penalties that have had to be paid back for healthcare fraud. This was just on April 4th in Oregon. A medical practice manager was sentenced to prison for false billing and tax fraud, okay, to the tune of $1.7 million in restitution to Medicare, Oregon, and several private health insurance companies, and $817,000 back to the IRS. And notice this was a medical practice manager. It wasn't the doctor. It was the practice manager that was committing fraud. So can we be liable? And the answer is, unfortunately, yes. And this is why we're having this training, is because I want you to be protected. I want us as a company to be protected from these types of situations occurring. Now, would this ever occur with us and the type of clientele we have to this extent? Probably not. But, you know, we have some big clients, and these, fortunately, the big clients that we have are, you know, in fairly good shape from a compliance standpoint. We still have work to do with them. Even the ones that, you know, think that they're compliant are not in all ways compliant. So we have to be careful and make sure that they understand where their holes are in their compliance program. Here's another one. A biller for a medical equipment provider was sentenced to 4 years in federal prison for healthcare fraud, aggravated identity theft, and defrauding the IRS by failing to file tax returns. Okay, and so again, these are serious things that are taking place. The OIG is making a lot of money on returning funds back to the Medicare and Medicaid trust fund due to healthcare fraud. So what we're going to do today in this short training is to, number one, identify areas of risk, okay? And there are 3 areas that we're going to talk about today, and we're going to talk about possible solutions to closing those gaps in the area of risk. So the first area of risk that I want to talk about today relates back to what is happening between you and the client. Okay, and this is where clients are submitting claims to us for us to bill out that are not substantiated. And what I mean by not substantiated is that they're having us bill for services that did not even take place. The level of service that we are billing out is not justified by the documentation. or there is no documentation for the service provided, or the doctor is asking us to kind of fill in the blanks and do coding that, in other words, just telling us to, well, just code it this way, and we don't have any documentation to substantiate their request for us to code something a certain way. Okay? Now, at this point, what I'm going to do is I'm going to pull us off of mute, all right, because I want us to be able to talk about this, and so please be careful if you have like background TV or whatever. Please turn off any background noise so that there's not a lot of background noise going on right now. So let's talk about some of the other areas of risk. The other areas of risk that we have, I think, is that we as a company are not addressing issues of blatant fraud, or have not, or may not at some point. We're afraid to rock the boat. We know that there's fraud going on with a client, and we're not addressing the issue, and we do nothing about it. That is not good. We have advised clients maybe of problems that we're seeing with reference to compliance issues, but it's not documented anywhere. We've just advised them verbally. And we really, I've heard some of the billers in the company where I've talked to them about compliance issues, and they're like, well, I've told the client this. Well, that's not good enough. We have to document it. We need to make sure that we have an effective policy and procedure set in place for warning a client and me as the corporate entity of any issues of noncompliance. And the bottom line here is, if we know it's taking place, we are culpable and therefore subject to monetary penalty and possible conviction. So we have to make sure that we are covering ourselves under this particular area of risk. The third area of risk that we're going to talk about today are HIPAA violations. How we handle email and electronic communication with the client, how we're protecting PHI on our personal computers, and how we're protecting PHI on our home office space. So let's go ahead and get started with the first area of risk and possible solutions. Again, I don't want to scare you, but here's the bottom line. If any of our clients are audited and they are found to be in compliance of billing, so for example, let's say they get audited and they have to have a recoupment of X number of dollars, we can be liable for a portion of that recoupment because we have accepted money from them for those services that we've billed. And so we can be asked to recoup some of that money. If blatant, and not only is there the recoupment, but if they're found to have fraudulently billed, and the difference between fraud and abuse is, abuse is we didn't know about it, and we didn't know there was a problem, we didn't know we were doing it wrong, and my bad, we're going to fix it and we're not going to do it again. That's abuse. Fraud is knowingly. So the client knows, they have been to compliance training. Now that you've been to compliance training, you know, okay? And because of that, if you know and you continue with the same behavior, that moves over from abuse to fraud. If it's fraudulent, then penalties can be assessed on top of the recoupment anywhere from $10,000 to $30,000 per incident. And when I mean per incident, if you're talking about a claim, we're talking about per line item of the claim. So if one date of service, that bill is shown to be non-compliant, okay, and then it is determined that that bill was billed fraudulently, and it's not just a simple recoupment, but it was billed fraudulently, then if there were 3 services and all 3 services were billed fraudulently, that's a $10,000 per line item service. That's a $30,000 penalty on that claim. That's why some of these OIG investigations are netting millions of dollars in fines and penalties. It's not that they build out millions of dollars, but by the time they tag on the fines and penalties, it's into the millions of dollars, okay? So what do we need to do as a company to protect ourselves from this happening? Obviously, as billers, we don't know whether we're submitting fraudulent claims many times, do we? I mean, they post the charges and we pick it up for billing and we run a pre-bill report, but you know, if they say that they've done a 98941, we're assuming that they have documentation to substantiate that, okay? And as a billing company, we're not going to get in trouble for billing something they tell us to bill unless we suspect that it's not right. Okay, so for example, here are some of the things to look at. If you have a client that is using the same diagnosis codes for all of their patients, you might have a problem. If you have a client that is billing the same exact services on all of their patients or the majority of their patients, you might have a problem. So if every service is a 98941 and a 97012, which is a 3 to 4 level adjustment and a traction, and they bill that every single time and it never changes, that could be a problem. Because you know what may be happening is what is known in the documentation world as SALT, and SALT stands for same as last time. So many times the doctor's practice management software program will take a note, and then when the patient comes in the next time, it transfers all the information from the previous note to the new note. And that's called salting, same as last time. But maybe the doctor that day didn't do traction. Maybe that day the doctor only did a 1 to 2 level adjustment instead of a 3 to 4 level adjustment. But the doctor's not paying attention. They're in a rush. They have the next patient to go to, and then they just click the note and they send it on, and it gets posted as a 3 to 4 level adjustment with traction, when in fact it was a 1 to 2 level adjustment without traction. Okay, and I'm just going to tell you, you know, I mean, this is all scary stuff, and I'm pretty convinced that we don't have any clients in Gold Star who intentionally bill fraudulently. I do not believe that. I do not believe we have crooks in our midst. We have actually taken on some clients in the past who it became very clear very early on that they were crooks, okay? And I let them go very quickly. All right, I most of the time in those situations, those clients never got past me. They never even got to a biller. I saw what they were doing, and I just basically said, I'm sorry, we can't take your account on, because if we did, we would have to report you. Okay, I mean, and I've actually had to do that with probably 3 or 4 clients over the 10 years that we've been doing this, where I have not accepted them as a client, or if I've accepted them, I've had to cut them loose pretty quick, because I could tell that they were crooks, and I didn't want to put the company in that kind of danger, or any of my billers. Okay, so most of the time, these errors that are taking place are unknowing errors. However, if the doctor is continually having a pattern of bad behavior and they know better, it can still be construed as fraud. All right, just because they're lazy and don't check their notes doesn't mean that they're only going to get a slap on the wrist and a recoupment. They could actually be, you know, this could actually become a fraudulent situation. So here's what I would recommend you do as a biller, okay, to protect yourself, to protect Gold Star, and to protect your client, is on a monthly basis, ask each of your clients for notes on 2 to 5 claims that you're submitting for. Okay, if You can get the notes yourself. Just pull them. You don't have to ask for them. You can view the notes in the EMR system. Take a look at the note and see if the note substantiates that level of service that you're billing for. If any of you feel like you need training on that, you can certainly contact me, and I will be happy to do, and actually I am going to be doing some documentation training with you guys on what constitutes a valid note. That's going to be our next training that we do next month. But if you have something between now and then that you that you see that doesn't look right, ask me to put my eyes on it, and Trang may be able to help as well, because she's also a medical compliance specialist. We can have Trang take a look at it. Angela has a pretty good idea of what a good SOAP note should look like. So we have some people in the company that can look at notes if you feel like you're not experienced enough to do it. But I guarantee if you start doing this and you start looking at your client's notes, 2 to 5 claims a month, you're going to start getting better at recognizing notes that are not complete or are not matching up to what is being billed. Okay? You want to analyze those notes for accuracy, and if you find problems or discrepancies between the note and what the client is asking us to bill, you need to send the doctor an email outlining those documentation errors, and you need to copy me on those on that email. Okay? And it doesn't have to be in a nasty way. It can just be, doctor, as part of our compliance program, we have been doing internal audits on your documentation on several claims each month, and here's what we found. And here's what we recommend as far as a corrective action. And we have to send that in an email, because if you just call them, then it might as well have never happened. There needs to be documentation. Okay. What I will do is, when you email that to me, I'm going to copy that email and place it in our compliance manual under the non-compliance section. And so if you send the doctor an email outlining documentation errors, then you're going to want to follow up with that doctor in a month to determine if there have been improvements in the doctor's documentation. If you find that documentation errors are excessive, it's like, oh my goodness, every single time I pull documentation on a claim, not a one of them is accurate, then you need to notify me immediately so that I can schedule training with the doctor and make sure that we're getting them in line with their documentation errors. Okay? And then the final thing is, if the doctor or the office ever asks you to change a diagnosis code, or well, just put in the diagnosis code that you think I should have, unless you can pull that diagnosis from the doctor's notes, and based on what the doctor has said in the exam, which means you would need to be a coder in order for you to be able to do that. You'd need to know how to be a certified coder in order to do that. You have to get that change in writing. Okay. Now, if you have a claim that doesn't get paid because the primary diagnosis wasn't in there, or the primary diagnosis was in the wrong order, and you need to change the diagnosis code order, that's fine. You can do that. Okay. But you cannot ever change a CPT code or a diagnosis code because the doctor tells you to do it. It has to be in writing. Okay. Everybody is off mute. Do you have any questions or comments about this?
Hello, everyone. It's Angela.
Yay!
Can you all hear me? I do have one client who I am a little bit concerned about with fraudulent billing.
Okay.
It's not that the coding is bad. It's when CareSource, which is a Medicaid program, is secondary. So what they're trying to do is, let's say UnitedHealthcare is primary and they require an authorization to be seen. They don't get the authorization and they still want me to bill CareSource. And they want me to change the denial that says no authorization and change it to no coverage so that CareSource will pay.
Can't do it.
And they've been doing that for 5 years.
Yeah.
So what do you think on that?
Well, I mean, they can't do that.
I know, I told them that.
They have.
So they started to get a few ACNs, but not all.
Okay. So what you need to do is you need to say, in my, send an email to the doctor and say, to actually both doctors. I know who you're talking about. You send the email to the doctors. You don't have to send it to the staff, okay, but just to the doctor's private email, and say, all right, I just did my annual compliance training with Lisa, and it was brought, and some of the things that I learned in the compliance training makes me realize that we need to look at the way we are doing this, and then outline that thing according to the guidelines, the compliance guidelines. If an EOB is received that is a contractual obligation write-off, and we submit that to the secondary, we have to submit it as it stands, or we have to appeal that decision before we submit to the secondary to get a patient responsibility denial, or to get a denial that the secondary would consider for payment. We cannot.
Okay. It's not the first Ohio client. It's the second one.
Okay.
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 Okay, I will take care of it.
Okay. So again, so you would go to point 3, send the doctor the email outlining the errors, copy me on the email, okay? And that goes for whether it's basically billing noncompliance or noncompliance in their documentation. Make sure that you're CCing me on any emails that you're sending to your doctors with respect to noncompliance. Okay, Angela, does anybody else have a situation? And this is all staying between us, okay? So nobody's going to get in trouble here, but we need to know if there are problems so that we can give the proper guidance on how to identify them.
Well, like for me, I think I mean, they're trying to change, or one of the doctors trying to change, and then another doctor's not, but I still am on edge when I'm submitting claims to Medicare, because, it's either they're like constantly on active care and they've been on active care for like a year and a half. It's the same thing. It's getting better, but I think that one of the concerns that the doctor has is the financial. Again, we're going back to the financial, that they're having concern for the patient. It's like, how do you get them to steer their mindset away from that and focus on what they're supposed to be doing?
Frank, one of the things you should go to is go to the OIG website, and what you would want to do is you would want to find, and they're not hard, but there are several under the investigations section. There are several investigations of chiropractors who have had to pay back millions and millions of dollars in penalties to Medicare for just this reason, okay? And make a copy of that and send it to the doctors, okay? I am also, as part of my compliance program, corporate compliance program, I am the same documentation program that I'm going to be teaching you guys next month. I'm also going to be doing for the doctors at the doctor level. And, I mean, obviously, I can't make the doctors attend, but I'll have it recorded. It'll be sent to all of them so they'll know, and we'll document that all of our doctors were sent this training to complete, and they were strongly advised to complete this compliance training. And so hopefully this will put a layer of protection between us and the doctors as far as these types of situations. The good, actually for us, the good news is that we're not the coders. We're basically taking the bills as they are being entered in. The front desk people, unfortunately, and they don't even realize this, who are putting in those codes, are the ones that are more liable for the coding errors than we are, because all we're really liable for as a billing company is if we know that there are problems and we have repeatedly, we see a blatant disregard for for compliance. And like you said, this doctor, it's getting better. They still need to work, but at least it seems like they're making an attempt to get better. If it comes down to where you and me need to sit down with this doctor and have a come to Jesus meeting, I will. Because, right now, Strategic Health Solutions is the auditing, they have the contract to do all the physical medicine audits for Medicare, all of them, okay, and that includes chiropractic, and they're hitting chiropractors really hard right now. Strategic Health Solutions, what they will do is they will ask the chiropractor for 35 charts. They will then analyze those charts against what was billed to determine if the documentation was accurate, if it was complete, and if it justified medical necessity for the codes that were billed. If they find errors on the document, they're going to assign an error percentage rate on those 35 charts. Okay, so there's going to be a general percentage rate assigned on those 35 charts. So let's say they find that 50% of those 35 charts had errors. They're going to assign a 50% error rate, and then what they do is they extrapolate the error rate, and they go back, and the look back period is 6 years. So then they're going to extrapolate an error rate on everything that was billed to Medicare for the past 6 years, and that's going to be the recoupment.
Wow.
Okay, and that's just the recoupment. If that doctor has had previous Medicare audit, so let's say they've been audited by Medicare before, and this is like their second audit or their third audit, and they extrapolate that 6 years, not only is it going to be the recoupment over that 6-year period, but it's going to be the civil money penalties, that $10,000 per incident fine. Okay? Mm-hmm. So very, and when I do the training with the doctors, this is what I'm going to talk to them about, is what Strategic Health Solutions are doing. And we actually have some doctors who are under audit by Strategic right now.
Wow.
So, this is not something that we want to play with. Any other comments on this particular situation, for this risk area? If you feel like you want to talk to me in private, then just send me an email and we'll set up a time to talk if you have, specific about your client, okay? If you don't want to talk to the whole group about it. Okay. Here's the goes to what we're talking about, is that we're not addressing issues of blatant fraud, okay? Now, if we have a doctor, let's say Trang, this doctor that you're talking about, completely ignores you and just keeps doing what they're doing, and it's not right, okay? You're going to have to send an email to the doctor outlining the general concerns, which you've already done, okay? Mm-hmm. And I've seen that email, okay? So you send it to me first for review and approval, and then once I review that email, I may have some, the way you word it or whatever, I want to take a look at it. CC me on the final email, okay? So preliminary email with your concerns goes to me. Once I'm okay with it, then I'll say, okay, send it to the doctor, and CC me on what you send them. Advise the doctor within the email that we need to schedule a phone conference to discuss the issue, and keep me apprised of any ongoing compliance concerns you may have with this particular client, all right? And also be aware, I don't want this to happen because I know I don't want you guys to lose work, but I also don't want you to put yourselves or the company in any kind of financial or worse risk by holding on to a client that could get us into trouble, all right? It's just not worth it. I mean, and it could result in us terminating the client's contract. We might have to say at some point with a client where, and it could be a big client, you know. And I mean, I shake in my boots thinking of it, but I also shake in my boots thinking of what the alternative is. And I know what's going on in the industry right now, and the bigger the client, the bigger the bullseye. So our bigger clients are at bigger risk. And as such, it puts us at bigger risk. So those of you who have the big clients, you have to be particularly careful of this, because Strategic Health Solutions is looking to these big clients for lots and lots of money in recoupments, okay? So if it means, you know, and I hope it never comes to that we would have to terminate a client's contract, but I would do it in a heartbeat to protect you and to protect the company. Okay, so just be aware of that. HIPAA violations. Okay, now this is on us. This is something that we as a billing company have to be careful about. And it is how we handle email and electronic communication with the client. This doesn't go into billing errors. These are HIPAA violations are actually more of a concern to us directly as a billing company and you directly as a person than even if we're tied to billing problems and, you know, and billing non-compliance, because HIPAA actually has the ability to investigate each one of our home offices. They can come in, they can knock on the door today and say, we have received a report from one of your clients that there may be a violation of HIPAA going on in this office, and we need to examine your office for possible HIPAA violations. Okay? And they can do this to each one of us because we have home offices. And HIPAA is one of those things that for many, many years, you know, HIPAA was out there, but in 2012, it became enforceable. Okay? And so number one is how we handle email and electronic communication with the client. So if possible, you need to explore any means necessary to communicate about patients through your practice management software. For Eclipse, that's daily reminders. For ChiroTouch, that may be a different communication system. You know, Trang is taking on a brand new client. Just today we had a discussion about this in our orientation call about finding the method through the practice management software that we can use to communicate with clients, okay? So it should go through the practice management software. If email is necessary, so if the practice management software is so rudimentary that you can't use it, and email is necessary, all patient health information that is discussed in an email should be de-identified, and that includes any attachments. Okay, so what I mean by that, as far as de-identified, is that if somebody, if a hacker were to intercept that email, could they identify the patient? And ways they could identify the patient would be a policy number, name, date of birth, address, basically anything that would identify that patient. So when at all possible, if you're sending out an email, patients should be identified by, let's say, like an internal account number, patient account XXXX, or you can use a patient's name. If it's one piece of identification, that's fine. If there's more than one, then that's not fine. Okay, so if it's Smith R, that's fine. That cannot easily identify that patient. Okay, but if you put Smith R DOB 4762, then that's not de-identified, because that's two pieces of information that identify the patient. Okay, now you can do the patient account number with a date of birth, because the account number is just a random number. That's not an identifying factor except in an internal software. Okay, so be aware of how you're sending emails. Use an encrypted email service if necessary. Believe it or not, for all of you who have Sukasa, Sukasa has a way to encrypt emails. Okay, please don't ask me how to do it. Contact Sukasa, but you can use Sukasa to encrypt your emails if you need to. It's not preferable because it is a pain in the butt to encrypt an email, but you can do it through Sukasa, and all of you have Sukasa accounts. If you see a client violate HIPAA, let's say they send an email to you and they use a patient name or do not de-identify information, advise them immediately of the violation and tell them not to do that anymore. Okay? And I know we have clients that are notorious about that, but if we don't advise them of the violation, then we're also in violation. Okay? To protect PHI, now that is email. Anybody have a question about email? Okay. Personal computers. We all have computers in our home office. Every one of you has a different office setup. Okay. And each one of you will have computers, and some of us have computers that are used by more than just us, or they're used for both work and personal. So number one, make sure that if possible, and I know it's not always possible, have a computer dedicated only to your work. If it's not possible, then most computers, especially if you have a Windows program, I'm not sure about Mac computers because I'm not well versed on Macs, but if you have Windows, you can set up a separate login for your work. Okay, and at the end of the day, you can log out of that and then have a kid's login, and your husband's login or your wife's login, and have different logins on one computer. Okay, so if possible, make sure your computer is dedicated to work only, and anytime you are on your home computer and you go away from that computer, if somebody is in your house, log out of all of your programs when leaving your office area. That includes your practice management software, log out of Dropbox, log out of Sukasa, log out of your email, and any remote connections. Everything should be powered down if you're leaving your office, okay? Especially if your office is not secure, if it's not a separate room. Okay, now if office is a separate room and you have a lock on the door, then you can leave everything going and you can just lock the door. That's fine, all right, because you're securing it. But other than that, you want to log out of everything. And really you want to, and especially if you're remoted into a doctor, you definitely want to log out at the end of each day. You don't want to stay logged in to that doctor. All documents that contain PHI that are on your computer should be in an encrypted folder, either in Dropbox or Sukasa, or on an external hard drive that's locked away at the end of the workday. Never put a document on your desktop or in an unsecured folder on your hard drive. Okay? And so, I don't know where everybody is at with this. If you're reading this and thinking, oh crap, I've got some work to do, that's fine. Just let's make sure that we get this our house in order when it comes to PHI. And I'm just going to say, I'm as guilty of this as anybody else. My office is not secure. I have my office in my dining room. You know, I have at times left out billing reports at the end of the day, you know, and I mean, do I trust my family? Of course I trust my family, but you know what? That's not the point. The point is, if HIPAA were to come in and investigate me, I'd be in a lot of trouble. So, you know, I'm speaking as much to myself as I am to you guys. So please understand that. Protecting PHI in your home office space. Ideally, your office should be in a dedicated room in the house. Now, this isn't possible for everybody. I know it's not possible for me, at least not until one of my kids leaves, you know. And once they do, then I can move my office into one of the bedrooms, you know. If possible, and you do have your computer in a separate room from the house, you should have a lock on that door, so at the end of the day, you can lock it, and only you have the key. All right. And if that's not the case, then all patient health information, PHI, that's anything that's paper EOBs, billing reports, AR reports, etc., should be placed and kept in a locked cabinet at the end of the day. So you should have a filing cabinet that has a lock. Just gather up those documents, stick them in that filing cabinet, and lock the cabinet at the end of the day. Okay? If you have people in the house and you leave your desk, secure PHI. All right? What I mean by that goes back to everything we've just talked about. Turn off your computer. I mean, I mean, let's get real. Let's say you're just going to the bathroom, okay, and you're going to come right back. If that's the case, you may want to just turn your screen off. Go to the bathroom, you know, I mean, because in the time that it would take for somebody to turn the screen on and steal somebody's identity or whatever, you know, that's not going to happen. But at the same time, if you've got people in the house, especially for those of you who have kids, who have friends that come over, you know, it's a problem. I'm going to share with you, I think I've shared with some of you this in the past, but we actually, many years ago, this goes back about 8 years, I had a biller who had an account. She was working in the account, and she was remotely logged in to the doctor's office. She left everything open. She didn't turn off her computer. She didn't remotely log out. She was still in the program. Okay? Later on that day, her 8-year-old son came home, and he decided to get on the computer and play SpongeBob SquarePants on the computer. He didn't know that Mom was logged into the doctor's office. All of a sudden, the doctor walks by and he sees somebody playing SpongeBob SquarePants on his computer. You would not want to have heard that phone call that I had from the doctor. I mean, and I had to, in order to keep that client, I had to fire the biller because of what happened. And so, you know, I don't want that to happen. You know, I don't ever want that to happen again. So, you know, please be diligent about powering everything down, putting everything away at the end of the day, and securing anything that would have patient information on it, anything that would compromise the client's identity, such as NPI numbers. If you've got sticky notes with NPI numbers on it, you've got to protect those. Keep those out of sight. Okay? Anything with passwords on them, please make sure that you clean up your office space and protect all of that information from the risk of identity theft. Okay? And from the risk of HIPAA violations. Any questions on that? If you have documents that contain PHI that need to be discarded, before you discard them, store them. You'll need to store them in a locked cabinet or a trash bin, and then either take them to a shredding service, use your own shredder, or have them burned. I know that I've actually had a couple of billers who have had their husbands get a like a trash can with a pop-up top and put a lock on it, and then saw a hole at the top of the trash can so you could just start throwing your PHI into that trash can. It stays locked, and then when the trash can gets full, then they take it to a shredding service, and the shred and unlock it, and the secure shredding service takes care of it. You can use your own personal shredders if you want to shred as you go, or for those of you who live in the country, light a bonfire and just make sure that every single document is completely burned in the fire, okay? And I've actually done that. In the wintertime, I have taken stacks of PHI and I've burned them in my fireplace, okay? And make sure, use my poker and make sure that every single scrap of that paper is nothing but ash, okay? So it can either be shredded or burned, and never throw away or put in your trash to be picked up by the trash people whole documents that would contain PHI. Okay, that is it for the training today. I'm going to stop recording.